Welcome to the 2020 Staff and Board Appreciation Event. Enjoy!
Welcome to Sadler Video Night, everyone.
There you go.
Welcome to Sadler Movie Night.
Welcome to the Sadler Movie Night.
It all began 50 years ago as a modest social experiment during America's war on poverty. The goal? To bring doctors and primary and preventative health services into poor urban and rural communities, places where health needs were neglected and ignored by mainstream medicine. A revolutionary partnership was created, bringing together for the first time reform-minded physicians, nurses, local community leaders, and the federal government to build a new type of community-based health care. It would serve all people, no matter who they were, where they lived, regardless of income or insurance status. And it would empower and give voice to people living and working in those communities to direct how health care was to be delivered. That small investment 5 decades ago has saved countless lives and strengthened thousands of communities. Today, community health centers stand as the largest and most successful primary care system in America. Through their shared mission, they provide high-quality, cost-effective services, including medical, dental, behavioral, pharmacy, and vision care. Community health centers are a vital health safety net for more than 23 million Americans, including 7 million children and over 260,000 veterans. In over 9,200 communities, they are opening the doors of healthcare, giving more people the chance for healthier and stronger lives. Community health centers go beyond the traditional 4 walls of medicine to break down barriers that often keep people from getting the care they need, such as lack of transportation, language and cultural differences, income, and insurance status. Health centers also work in partnership with others in the public and private sectors, developing local strategies to address the root causes of poor health, such as nutrition and food insecurity, homelessness, environmental conditions, and unemployment. Community health centers are a leading model in primary care practice, helping to transform healthcare delivery in America to enhance quality and reduce costs. Years of research shows health centers are more accessible than other providers to patients who are new, uninsured, or have Medicaid. Health center patient outcomes are as good as or better than those of other primary care providers, even though health center patients are challenged with more complex health needs. Health center care reduces mortality, health disparities, and risk of low birth weight. Community health centers have broad support in the public and private sectors because they produce value, not only for their patients and local communities, but also for governments at all levels, and the American taxpayer. When compared to other healthcare providers, health centers produce over $1,200 in savings per patient per year, and health centers generate $24 billion a year in savings across the entire healthcare system. Their patients are less likely to visit emergency departments for non-emergency care, and hospital stays are lessened or even prevented because health centers focus on prevention, patient education, and effective management of chronic and costly diseases. But health centers are more than just healthcare providers. They serve as economic engines in some of the nation's most resource-disadvantaged rural and urban communities, stimulating job and small business growth and purchasing goods and services. Collectively, health centers generate an estimated $26.5 billion in economic activity in local communities. Nationwide, health centers employ over 160,000 full-time doctors, nurses, and other healthcare professionals and support staff. And that includes our nation's veterans. They are often one of the largest providers of jobs and job training in their communities. As America's need for primary care doctors, nurses, and other healthcare workers continues to grow, teaching health centers play an important role in ensuring an adequate workforce for the future. And as frontline providers, health centers aid in protecting their communities and overall public health in times of widespread healthcare emergencies and natural disasters. Since their early beginnings, community health centers have been called on to do more and more, serving greater needs, and they have always answered that call, making people healthier, strengthening communities, and producing value. Yet today, 62 million Americans still live in areas with little or no access to doctors or health services. So the question is, will community health centers be needed in the future? The answer is yes. Imagine an America without them. America's Health Centers. Value in healthcare today and tomorrow.
Ziplining for the first time last year.
Some people call me Eminem.
So my fun fact is that before I got a bachelor's in graphic design, I also studied to be a travel agent, a massage therapist, and a chef.
My fun fact is I used to be a gymnastics coach.
There you go.
My fun fact is I was a stay-at-home mom for 15 years.
Okay, so fun fact about me is that every couple years my birthday falls on Thanksgiving.
Halloween is the best time of year.
Go.
I lived in Canada for 8 years and moved back here when I was in 9th grade.
There you go.
I used to country line dance every Saturday night starting in 2004 until they closed at Scott Donato's Tractor Twang.
I have 2 children, both born on April Fool's Day.
Go.
Fun fact about me, if you don't already know, I'm a homesteader quasi-prepper, so we're pretty much as self-sufficient as we can be.
Yeah.
Fun fact about me is I love horror movies and I love to watch them with my kids.
Drew's fun fact of the day is I like to secretly watch romance movies by myself.
Alright, so my fun fact is I've been to 15 different countries.
There you go.
So fun fact about me, I am adopted from Russia.
Go.
I am addicted to board and brush, crafting, and painting.
Go.
My fun fact is I'm very good at finding 4-leaf clovers, probably found over 100 in my life.
Go.
Okay, fun fact about me is that I once played the role of Sally, Charlie Brown's sister, in the school musical.
Fun fact about me is that when I was in college, I played lacrosse, and actually I held records there for about 20 years. until somebody bumped me off. So I was a record keeper at college.
I was a cheerleader in middle school and high school.
Go.
Hi, my fun fact is I like to ride four-wheelers.
I'm into yoga and meditation and mindfulness. Just wanted to let you know, fun fact.
My fun fact is that growing up I did beauty pageants and modeling.
My one friend, she was prescribed painkillers, and she told me it would help my back, and I tried them, and at that time I did not realize the gravity of how much trouble it would put me in of taking the painkillers. And I quickly became addicted to them.
I was married, and about 2011, my son, who has autism, knocked out my front 2 teeth. He headbutted me. He did that several times, and I went to the dentist, and I needed some work done. I also had an abscess, and it was so painful. He prescribed me some painkillers, and I kept thinking, well, if I'm only going to do a little piece of one, it's really not that much. But I was doing that over, I don't know, the past 8 years, till finally I lost my marriage.
Right around the time I turned 21, I kind of fell in the run with the wrong crowd. I made some dumb decisions, pretty much. Got caught up in drugs, and did that for about a year and a half. I got pregnant with my first child. I overdosed.
You're just tired and you're beat from this constant cycle of continuing to damage everything in your life. It's either this or death. Like, you have to stop it somehow.
The last day I took my last piece of pill, it was on the bottom of my floor mat, and it was wet and muddy and disgusting, and I ate it off the floor. I licked it off the floor. Because I would have ate it out of someone's mouth. I mean, when you're addicted like that, you don't care how, as long as you're getting it, you don't care how you get it. And that's when I knew. I mean, I really had hit rock bottom, and I felt dirty, I felt ugly, I was ashamed, and that was my first day of being honest with myself and everyone else, that I was a drug addict.
We work with patients on changing their attitude toward substance abuse.
It's a very comprehensive program. Taking medications for opioid addiction is like taking medications for any other chronic illnesses. There are multiple medications that can be used. One of them is buprenorphine, which is a partial agonist, and it blocks the opioid receptors, and that's why it prevents cravings. During our appointment, based on the history, we gauge what medication is needed, and then on that particular day, they also meet with case management. We set up appointments with behavioral health services and then prescribe the medication.
Here we do it differently. We make the patient a part of the team, the doctor, myself, we all come to the same conclusion for what is ever is best for the patient.
We believe in treating the whole person at Sadler Health Center, and the outcomes are proven to be successful. It treats the root causes of the drug addiction that were there in the first place that maybe led them down that path. And doing that assists the patient in moving on and rebuilding relationships with family and friends, and being able to go, back out to be productive in society, have a job, you know. It really helps them to move on and refocus from addiction to recovery.
Very compassionate people, very caring. They really wanted you to succeed, and they really took an interest in making sure that you were going to meetings, making sure that you were taking your medication properly, and making sure that you were going to be ready for the next step.
I wanted them to look at me, you know, like as a human being, and they did. They never judged, never criticized, always made me feel good.
What makes this program work better than some other programs is that we are here to help them. They know that. We show them compassion, we respect. We are not judging. We're here for them, any person, regardless of age, sex, race, if they're unemployed, homeless, if they have insurance, they have no insurance. We are the place that will take them, I would say, in the community with open arms.
Addiction is a disease of the brain. It is not a moral failing. And that is what we have to educate the community. There is this huge stigma that is associated with addiction.
I don't care who you are, you can't do it alone. And the Sadler program, they're there to support you and lift you up and guide you to where you need to be today.
Medical assisted treatment is a way that we can teach the brain how to live without narcotics. I can see people that come to me often from the depths of despair, and a year, 18 months, maybe 2 years later, they now get their kids back, they get their families back, they're able to hold a job, they're able to be productive in society, and they're able to feel good about themselves and able to live without narcotics.
I don't know where I would be today if it wasn't for the Sadler program. It made me want to wake up every day. It made me feel better about myself. And it gave me another chance. And I'm so happy.
I was on the path of destruction. My family had written me off. Nobody wanted to be friends with me. And, you know, I got all of that stuff back because of the program. I can live a normal life, and every day is a new day.
It's given me hope that I can actually be a productive member of society, that I can actually work towards my goals and have a future and be somebody that I can like and that I can enjoy. So it gives me a lot of hope.
Hope springs eternal, and all you have to do is call and we're available for you.